few years ago, before I heard of Grace Clinic, I had a severe toothache. It was so painful that I myself tried to take some needle nose pliers and pull it out myself. Let me tell you, don't do that. That was the worst thing I could do. After I did that, the tooth did not come out. It raised up above all my other teeth, so every time I went to eat something, I was in severe pain. I had a friend who realized that I was trying to pull up my own tooth, and she had heard about Grace Clinic. So she told me I should go there because she knew I didn't have any insurance and that they have a great dental program here.
So here at Grace Clinic, we do our general exams, full x-rays, fillings, extractions, and deep cleanings. The patients that come here, they're uninsured. A lot of our patients are here because they're in pain. They're needing, relief, and some of them just haven't been seen by a dentist for so long, haven't had cleanings for a very long time.
I work as a server in a local restaurant. I think I'm getting kind of older, but I'm still strong enough to do this job. I love it. I wish to open my own restaurant one day, and then, I'll be the boss, but I think I'll still be out there taking tables because I like to interact with the customers. I'm 53. I've raised 3 boys by myself. I'm originally from California, moved out here to give my boys a better life.
We have the updated software for patient management and quick access to digital x-rays, as you can see here. This gives us a really good understanding of what is needed and also being able to explain to our patients, not just telling them what they need, but also why they need it. So here the doctor is noticing that this tooth needs attention. Then the hygienist will evaluate the gum level, the bone level, just to get a better understanding of how we can move forward. We have now the updated x-ray machines here. So instead of having the big ones that we have in the wall, we place them and have to run out of the room. We have these handheld ones that are very nice, a lot more comfortable for our patients and way more convenient. We have from every instrument, from your basic one to your surgical one. We have all the updated equipment to do almost any procedure that a patient may need.
I try to tell people too, if I know that they don't have insurance and there's something wrong with them, I let them know that Grace Clinic is here. You just have to fill out some paperwork and talk to their representatives, and they're really nice people. They try to work with everybody. They even give out food here for those who don't, that need a little help.
Cost can be one of the bigger factors. So us being able to offer a free service, it's absolutely amazing. The patients are so grateful for what we can do for them. I think it is just amazing for them to not only have the relief of whether it's the pain, but also know that they're not going to get this huge bill at the end of the service.
When I originally came in, I came in for the tooth, but the doctor also found that he said I had a goiter. So he diagnosed me with diabetes and thyroid issues. I decided to come back to Grace Clinic because I knew these doctors are good and I needed help. Without having insurance, I couldn't get my medication. I needed my diabetes medication, I need my thyroid medication. And without Grace Clinic, I don't think I'd know where I'd, because there's no programs out there that help you. And Grace Clinic and the doctors and nurses that volunteer here are wonderful. Some of the doctors are retired, so that says a lot, that they care about people, because they're no longer getting paid at all to be a doctor or a nurse, and they're still giving their time to help people get better, to help our lives, and I think that's very important.